Good morning, ladies and gentlemen. Thanks, the moderator, for the kind introduction. Um, I would like to start by inviting the panelists to come over to take up their seats. I will start by Dr. Daudi Jingo. Please, if you are in the house, walk forward and take a seat up here. We have Dr. Davis Musinguzi. Please walk up and take a seat. Dr. Ruth Obaikol. We also have Dr. Ernest Mwabaze. And the next one is So please, those have read, whose names have read, please walk up and take a seat.
My name is David.
So to kickstart our panel discussion, I would like to, first of all, take this opportunity to give the context of this discussion. My name is Alfred, and as mentioned earlier on. It is my honor, ladies and gentlemen, to have the panel discussions here addressing Africa's healthcare needs through artificial intelligence. We know that artificial intelligence is rapidly transforming global healthcare, and Africa stands to benefit immensely from these advancements, from combating infectious diseases to improving maternal health and reducing healthcare disparities. It is anticipated that AI has the potential to transform some of the continent's most pressing health challenges. However, the successful application of AI in health requires a multidisciplinary approach, bringing together expertise from technology, medicine, policy, community engagement. So our panels today bring diverse perspectives to this context and expertise to crucially converse, and we look forward to their insights on how AI can be a game changer for African healthcare landscape. I'm going to kickstart this discussion by asking a question about infectious diseases. I will start with Dr. Jingo Daudi. The context is that infectious diseases like malaria, HIV, AIDS, and tuberculosis remain greater causes of morbidity and mortality world over, and more so in sub-Saharan Africa. AI-driven solutions such as predictive analysis and diagnostic tools are beginning to show promise in addressing some of these challenges. In your thinking, what are the specific examples of AI application in the current situation of infectious diseases within the context of African region? Is it possible that an AI-driven solution such as predictive analysis can be used to diagnose these diseases? What examples can you give for this case?
So thank you very much, Mr. Moderator, for broaching this discussion around potential or current uses of AI in infectious diseases. So the first comment I'm going to make is really a definitive comment, which is really what we mean by AI in this case. So that the technical experts here will tell you, like Ernest on my left here, there is such a thing as machine learning on the one hand, and then you have artificial intelligence on the other. And what we notice is that, these are not black and white definitions between these different technologies. Actually, there's a lot of overlap. So really, data science is playing a whole spectrum of roles. But from a very technical perspective, if we are to define artificial intelligence very strictly, I think, like you mentioned, Mr. Moderator, it is still a very young field in infectious diseases, especially in our context here. Regardless, it has a lot of upstream applications. At least in Uganda here, we've seen a lot of use of AI, especially generative AI, which is built on large language models and the ability to process and understand and interpret language. I think that one is fairly well used because we see a lot of chatbots. I think Dr. Mbaka referenced this earlier on today. We see some use of chatbots. We just developed some. I know we've developed some in the African Center of Excellence in bioinformatics, which are trying to help communicate responses to epidemics, and that is, and to be very specific. So the one, for example, that we're working on was one which was helping frontline health workers access information. So the Ministry of Education has a Ministry of Health has about a 300-page document with guidelines on how health workers should respond to specific scenarios in the field regarding pandemics. And so generative AI has a role to play there, and we've used some of it to help integrate that document so that health workers can just ask a question and they get a clear answer. And so that is generative AI. So it has a very clear role in surveillance for infectious diseases, especially pandemics. In terms of diagnosis, that is also happening. Of course, Rose, who is the convener of this meeting, is working a lot to maximize its utility in malaria diagnosis. It is not yet very definitive, but in terms of the clinical process, and I think Dr. Sabrina will advise later on, in terms of the clinical process, I think it is still helpful for a clinician to be able to get an overall picture. I think where the technology is, and I think Professor Buyinza referenced it earlier today, where the technology is that it remains a sort of decision support technology. That means that the doctor still has to make the final call. The doctor still has to make the final call because they have all this training and they can be held liable. But they can still find these technologies very useful in terms of supporting their decisions. For example, the technologies can help them cluster information or organize information or classify information so that they can sift through it quicker. I think that is that is a utility right there. Now, the upstream side of clinical science is actually research. A lot of the drugs that you take or the medicines that the doctor prescribes to you is based on prior research, basic research. And in that particular field, AI is already having very, very important use cases. So especially in the field of DNA analysis, which we do in bioinformatics, DNA is by definition a big data type of information, which you cannot process with manually. You need computers to do it, and there's a lot of utility there in predicting how mutations are going to happen, and that does inform drug development. It informs our understanding of these diseases, how they happen, or the processes they go through in the body, and which processes can be targeted for treatment. So, and of course, there are some other upstream applications like education, which, you know, when you see a doctor in the clinic, you're really seeing a finished product. That doctor went through a lot of training. They have spent multiple years of training and experience. And in the training space, artificial intelligence has a lot of value, and there are so many examples that I could go through. So I think one area where it is still very delicate is prescription. Actually prescribing a drug and telling you, hey, Daudi, you have this, go take this at this dosage. There's a lot of potential for it, but the problem is that we've not yet figured out ways of of accrediting it. Because for a doctor, you can hold them liable. So if this thing messes up, you really have no way of holding it liable very directly. I think Mbaka did mention having to go through approval processes. I think those are areas where we're still lagging behind. But clearly, it's part of the future.
Right. Thank you so much, Dr. Jingo, for that insight. Dr. Jingo is a senior faculty, and his area of practice is the bioinformatics at the Infectious Diseases Institute. There's College of Health Sciences. So he has a very huge CV in that context. Now, just as a brief response from you, expected challenges related to what you have just described. What do you anticipate?
So I think all the data scientists and artificial intelligence colleagues in this room will agree that the biggest roadblock is with the data itself. It looks like there's a lot of smart brains that can develop a lot of excellent algorithms that are effective. And there's a lot of existing ones. But I think the biggest challenge we have is to develop our data systems. So collecting this data, of course, everybody knows garbage in is garbage out. So we have to develop very good data systems for one, knowing what data to collect, how to collect it, how to secure it, and because when you have data, you can really do a lot of very good data science and artificial intelligence. But above all, how to create trust systems around it. As they say these days, data moves at the speed of trust. So to the extent that we can start building systems that build trust around data, I think we'll be gaining a lot of mileage in beginning to solve that problem. But of course, you have to collect it, you have to store it securely, and then later on you have to analyze it and interpret it. So there are also blockages in the human resource pipeline. It takes a long time to train a really good person. There's a lot of teachers and lecturers in this room. Somebody could go and do a 1-week course and become very good at a specific technique. But to get a person to a level where they can really thoughtfully approach a data problem and thoughtfully link it to a solution, that takes a long time. And I think that's an area where we still have a lot of, where we have a gap. We need to train and train diligently and train for the length of time that it takes and have individuals come through the pipeline. Because once, as they say, the most important resource is a human resource, once that is sorted, I think there will be a lot of benefit for our ecosystem.
Thank you so much, Daudi, for those insights. My next question goes to Dr. Davis Musinguzi. The context is that there's a significant disparity that exists between urban and rural areas in healthcare provision. There are limited number of professionals that have been trained, especially for medical resources. AI has the potential to bridge these gaps through telemedicine, mobile apps, and remote diagnostics. So the question to you, Dr. Musinguzi, is that what role can AI play in addressing healthcare disparities across Africa, especially in providing quality care to the undeserved communities?
I think you mean underserved, not undeserved.
Underserved, sorry, yeah.
Because everybody deserves quality healthcare for sure. But I think first, I think almost every Ugandan is underserved in terms of healthcare. Even when you think you have the best health insurance, you're still not necessarily going to get the best quality healthcare out there. And that's because we have, so many different infrastructure, human resource gaps, and so on. So the real question is, how is AI going to help us make the best of what we already have? So if you look at it at several different levels, for instance, think about patients queuing up at Chirudu, for instance. You need to know, okay, am I going to serve based on, first come? Or are we going to rely on what we're trying to do, triage, to identify who needs to be seen first? Imagine if we could have tools using AI, taking the different parameters at triage that can enable us to identify who needs to be seen first and who needs to be seen next. And simple tools in simple scenarios provide for better healthcare, especially where you have a very where you need to take advantage of the golden window on who you provide care to in a scenario where you have a queue of 100, 200 people. So also thinking about it also from the provider's standpoint, the medical doctor in this case, what can we do using AI that can make the doctor's job much more focused on the patient and away from any other administrative task? One thing that takes up a lot of doctors' time when they're actually seeing a patient is taking notes. We have seen that a lot of AI tools these days can be able to take your notes for you. All you need to do is have a discussion with the patient, take the history, do the consultation, and on the side, you have, a recording of exactly what was said in audio, a recording of the transcript of what was said. AI can even write you the summary of what was said. AI can even help you extract from an international classification of symptoms and ICD-10 what the symptoms were and what the probable differential diagnosis is. Now, of course, ultimately, like was said earlier, we need to still leave judgment to the medical doctor to say, okay, based on my own judgment, this was the diagnosis, these notes have been reviewed and are correct. And that saves them a lot of time and definitely improves the quality of care and improves the standard of doctors that were not as good as to be better with AI than they previously were without it. And also when it comes to a point where you now need to provide a prescription, there are several instances where you have drug-drug interactions, where certain instances where, you need to pick one alternative over another because of pre-existing conditions. And there are a lot of things to factor into a prescription that may not be as easily fetched within a doctor's mind, one, because of the workload that they have within these facilities. So being able to have assistants and agents and co-pilots and whatever we may want to call them interacting with the medical professionals can reduce time, improve quality, provide more efficient prescriptions that lead to better outcomes, and also just following up with the patients. And we can automatically have AI determine which patients really need follow-up sooner rather than later. And all of this can be automated, whether you're doing it within electronic medical record systems, whether you're doing it within telehealth systems, to be able to improve what we already have existing within our infrastructure.
Yeah, thanks for bringing that in context. And I think this is a real-life situation on a daily basis the communities go through. There is a question of how inclusive will this be. Earlier on, Tony mentioned that a greater part of our community still believes in traditional medicines, witchcraft, there are those cultural norms. We have also had cases where people even decline blood transfusion in hospital when they need it. So how do we bridge that gap? How can AI become more inclusive in the context of being able to reach to every community that we access?
Yeah. So think about how the common man today, for instance, has interacted with AI. Most people's general understanding of what AI is only came to light because they were able to make a prompt into ChatGPT. Other people that knew of AI pretty much existed within universities and research, or statisticians and machine learning experts. But the common average person only knew ChatGPT as the way that they automatically got answers and computations and analysis done without actually having the expertise or the knowledge of how to do it. But then to be able to do that meant you had access to the internet, or you had a smartphone, or access to the laptop, and things like that. But then if you now think about how do you make AI more inclusive, you have to start thinking about what is the lowest common denominator that you can use to extrapolate the power of a technology. So we know that there are still some very simple technologies that people use: SMS, USSD, voice calls. How are we going to translate the input and output of AI into simple technologies? How are we going to have all this compute seated in the background somewhere else, but really how people are making input into these AI computational systems is by a simple SMS, or by an automated voice call, or by just calling a USSD code that does all the compute using all kinds of webhooks behind the scenes that provides people with the results and the actions, AI agent actions that they need on their simple mobile devices. I think that's the only way we're going to really make it as inclusive as possible. How do we abstract the complexity of AI into the simplest technologies?
Yeah, thank you so much, Dr. Mushinguzi. Dr. Mushinguzi is the director of health entrepreneurs and an executive of that particular Rocket Health. Thanks so much, and I think you are getting it from right the ground. Our next question goes to Ruth. Ruth works with the Infectious Diseases Institute, and my question to you is in regards to the context is that we have limited healthcare resources. And these include the medical personnel, the equipment, and the entire infrastructure in the health system. I know there are the Ministry of Health representations here, but the idea is to see how do we leverage on what you have in order to get better patient outcomes. And so the question to Ruth is, an AI-driven tools could help drive this and optimize these outcomes. So how can AI be leveraged to optimize the allocation of limited healthcare resources in the context of workforce planning, supply chain management for medical equipment and medicines?
Thanks, Fred. I think I would like to paint a low-level picture. About 10 years ago, I was a manager of a small hospital in Kumi district called Dongino, and I took on managing that hospital when it was in a crisis. And we all know how there's just very little money to run healthcare in Uganda, but if you're thrown in a very remote area and a hospital is in a crisis, you know what that means in terms of management. For me, that meant I had to spend a lot of time counting every single cent and working and redistributing the very little or few staff that I had. Of course, within a crisis, you have many people leaving, the hospital, and you're left with very little resources. So for me, whenever the story of limited resources is on the table, that's for me the picture that I have in mind. And I remember so much about how much energy I needed to put into making that hospital run. And when you see that picture at very micro level and you scale it up to the national level, this is the kind of situation that probably Uganda is faced with. Very little resources. So the problems we see at micro level get amplified and even much more complex when you see them at a national level. And quite frankly, I think that when we talk about AI and data-driven decisions, this is where you make sense of, the need to even use data more. I mean, are you able to visualize, are we able to capture data at micro level and have, computers help us compute and analyze, and at a macro level be able to see the complexities or the variations that are happening across the country and redistribute our resources in more meaningful ways. Of course, with that comes, like Paul said, when we are adopting these technologies, we have to have a different perspective in the way we manage. We cannot manage anymore in a traditional way, and that means if you have to shift staff and make decisions quickly, you have to have a very agile system and way of management. That means mindsets have to change if we have to adopt these technologies for decision making. But also when it comes to medicines, we all know, I don't know, many of us here, I guess, go to private facilities to get healthcare. But for many people who get their healthcare from public health facilities, to arrive at a hospital and not be able to immunize your child because vaccines are not available is a real challenge, or to find that there are actually no medicines. And you can find that maybe a kilometer away from that health facility, one facility has more medicines compared to another. So the ability for us to redistribute medicines and distribute them in a way that is data informed and seamless can be made to happen with artificial intelligence. But also talking about, the members here have been talking about ChatGPT. When you think about healthcare, a lot of the work we do is process oriented, and sometimes even the time spent to think more scientifically, bringing your mind and heart to work becomes less, and the things of moving, patients or doing the process issues are things that we find ourselves as medical workers doing more. By the end of the day, you've moved around more than you would sit and give your heart and mind to a client. And I think for me, think about the quality of life of a healthcare worker, of our human resources as a nation. We can benefit a lot from artificial intelligence because it removes the pressure of process activities and allows healthcare workers to concentrate more on what what they're called to do the science and reach out to the softer side of what medicine can give to the client. So I think that it can help us to redistribute ourselves physically, but also within the way we deliver services. There can be more meaningful redistribution of care to clients.
Yeah, I still see a lot of huge trailers, vehicles moving with a lot of paperwork, distributing supplies across the country, and I'm pretty sure that happens in most parts of Africa. And in so doing, there's always, a lot of error, that come associated with that, and also loss, because anybody can create all these along the way. So, what examples of resource optimizers through AI have been successfully implemented in Africa? I don't know if you have an idea about that. And what lessons can we learn from this kind of implementations that you would be aware about?
Yeah, absolutely. My examples will be probably far-fetched because I think in the introduction of this conference, we've talked about how AI is young, and we are yet to integrate a lot of clever things that people have already done in the labs. But I think for me, my favorite was during the pandemic. And I think probably Dr. Jingo was part of the team that started predicting the waves. I think people stopped running around and we're able to now expect, for example, a wave of COVID to happen. If you're able to predict what is going to happen in the future, it gives you a lot of stability, an ability to actually mobilize your healthcare or your staff and your resources when it's needed most, and demobilize when you probably predict that not much might be needed. And I think for me that was a perfect example. If these waves of COVID had continued, and thankfully they didn't, I think that the use of AI would have demonstrated best how we can utilize our resources in a much more efficient way. But also I know within the HASH network, a hub for artificial intelligence for sexual and reproductive health, there are teams that have actually now deployed the chatbots in Kenya and Nigeria to provide health information to people in the population, in the communities. And I think for me, that has been one of the missing links in healthcare. Our ability to provide meaningful health education to our clients and even provide sustained health promotion to the population has been limited because we don't have those resources. So I think that the idea of generative AI and ability to push information out there creates, another line of frontline care that is sustainable and very efficient. And I think that that's a huge contribution that the teams are providing. At IDI, we also, during the COVID pandemic, attempted to develop a decision support system. It came out at the end, but again, if you were able to provide AI-driven predictive tools, those are cheaper compared to the screening tools that we have to develop and procure. Those are really opportunities that I've personally seen, and I think that are going to change the landscape of, efficient healthcare provision in the continent.
All right, thank you so much, Ruth. I was just, as you were explaining all that, I was just thinking about, we've had recently MPOX. I wish AI would be able to predict when it will end or when the next wave will be. But there's always a learning, Malaria guys in the house one time predicted that it would end in 2030. Recently, I asked a friend, we are left with about 6 years to go. But
I'm not sure, Alfred, whether that was an AI prediction.
All right, thank you so much. I know the audience has questions to this panel. We'll give you an opportunity to do that. The first three speakers were mainly from the health background. We have one other who is from the AI itself, as you heard, with the expertise in AI and deep learning and other learnings around that context. So Ernest is the executive director of Sunbird AI. Maybe you start by telling us what Sunbird is, and you can tell us how AI fits in there and how that fits into the context today. So the context for Ernest's question is that the success of AI in healthcare depends on access to large volume of accurate and diverse data. However, issues around data privacy, ownership, and representativeness are significant challenges in Africa. So the question is, what strategies can be employed to ensure ethical AI deployment in African healthcare system, particularly around patient data privacy and security?
Great. Hello. Yeah, thanks. Thanks a lot, Alfred, and thanks a lot, Rose and team, for inviting me here. I first of all, I think I also have a medical background. So my very first job when I left university, I worked for a project in the medical school called it was called Uganda Chartered Health Net. It was called UHIN, Uganda Health Information Network, and we're doing innovations in health. And that time, I met Dr. Lukande, I met Dr. Sabrina. Dr. Sabrina sold me my very first car. She probably doesn't remember. I probably go for a balance, but she sold me my very first car. And back in the medical school, would go and eat down at the cafeteria, and the ladies there would address me, Musao, unalie chenyanja. So I was really a Musao there. So I have a medical background as well.
Recording in progress.
Not just IT. All right, I did eat the fish though. Anyway, but yeah. So AI. I think one sort of reflection is the pandemic. For me, the pandemic was very revealing. It was sort of a litmus test, I think, for two people: one, pastors, and two, data scientists. So, I mean, the pastors who have been telling us they can hear things, they can see things. All of them were at home, with masks, sanitizing. No one was going to heal people in hospitals. And the data scientists who were proposing use of data to analyze these huge phenomena, predict them and predict trends and do this. Again, it was very, very hard to get a real example of someone using data to make a significant change on the COVID pandemic, right? So it was very revealing, what the practical impact of some of the work we do is. And I really like the example Dr. Ruth gave of really someone down in the health centers. And we just recently went with the team, Rose's team, we went to the eastern region. I went to the eastern region, and I think Busiu Health Center 4 or 3. And I mean the people there, the office, the medical officers working there. I mean the amount of patients they had. I think most patients get sick in the hospital waiting room than the disease. There are so many with kids with coughing. It's very hard to tell this person, okay, now we are investigating the use of compute or AI to solve your work. The guy is just too busy. He's really busy. He's really tired. He has worked the night or the day. So there are really real problems down there. Even things like data privacy. These are very important, but some of them tend to be fairly academic. Because you go to the health center and they're writing in this big book. They write the name, the address, the phone number, the disease, diagnosis. And you can go and take a photo and get this data. So there's a lot of work to be done there. But I think to answer the question, maybe to go back on the more academic front, I think to do with data, ethics, security, privacy, I think Becca is here. I'm sure he's going to talk on the next panel about the Personal Data Protection Office that has really stepped up. We've recently, as Sunbird AI, so Sunbird AI, we do practical AI for social good. We try and do the practice of AI. And we've been filling out our annual requirement with the PDP office, because they need to make sure that we are not violating the use of data in the tools we are building. So I think the first key thing is really regulation. And regulation both from the government side, which they're doing, but also internally from the organizations building these tools. Can they, or even consent, do people consent when you take their data for processing, this kind of thing. It's very important. And then also ethical building, responsible AI, responsibly building these tools. And I think something who talked about, maybe Paul, and I think Professor Tony as well, that we need to test these tools. We need to validate. There has to be some ethical checks on these tools and the systems we build. I think this is very critical for protection of data and security. Thanks.
Yeah, as you are really giving those examples deep in the Eastern, I was also trying to picture out what happens elsewhere in the East, in the North, and elsewhere outside our boundaries. I think it looks like the idea is to be able to build a database that should be harmonized across different regions, such that these remain robust, as it was described by Rose. So the question is, how do we address that? Lack of diverse and representative data to train AI that can effectively be applied across, the different aspects.
Right. So data. So they say data is the new oil. So data is a very interesting thing. So it's a commodity, unlike things like land or buildings. So land will remain there. Its value will appreciate, but you can say that's my land. Data is a bit complicated. So it's there, but it's also not there, right? So if you expose your data a bit, then it can transfer from here to the US to Canada to China in a blink of a second. All the data could go. It's very hard to hold data the way you hold a resource like land. And so how to manage data is definitely going to be very important. How to share it responsibly is even more important. When we've just recently been at a conference with Dr. Jingo here, at a very good island in Mauritius. I don't know if the team organizing this conference, I hope you can pick a leave, at the beach. But, they were talking about data sharing among different projects. And it's very, very hard. Even when we know we are here, we know each other, we're talking about these things. I'll ask Jingo for data tomorrow and he'll be like, I don't know, man. We took a lot of time to collect that data and I'm not entirely sure, right? So even data sharing, this is very important. And finding ways to do it realistically in a real sense, I think this is even more important. And I think even the people I admire are people like Davis, who have even gone further to commercialize. I think when you put a value on these things, then they become more important. You have a certain sense in which you look at them. They're not necessarily free. But, sharing that data realistically in a meaningful way, I think is very important for this community especially. Thanks.
Yeah, so it sounds like the way around that will be to have a common pool where most of this data is deposited with probably some regulated access so that it's not abused. So as I mentioned earlier on, it seems a couple of people in the audience have questions to the panelists here. As I mentioned earlier on, we have Daudi Jingo right next to me here. We have Ruth Obaikol, the only lady on among the panelists. Then we have Ernest, who just completed speaking here. And then Davis Musinguzi right at the other end. So if you have any question or comment, let's make the question short and clear.
Okay.
And very specific.
Thank you very much. The name is Margaret Nagovma, College of Computing, Makerere University. My question, thank you very much panelists and team for organizing. My question goes to Dr. Musinguzi, Davis Musinguzi. From the organizational perspective, we have issues when it comes to the AI paradox. Of course, here it's about redressing culture, structures, trust, skills, data sets, cost, and also edge cases when it comes to the medical world. From an organizational perspective, I want to help us appreciate the fact that we are not only creating a destroy, but we have to look at how AI can be used to effectively serve the clients or the patients. Kindly elaborate on the AI paradox in the medical organizations. Thank you.
Thank you very much, Chair or Moderator. My question to the panel is, to what extent does the national data support the work that you're doing? We don't know the total number of people in our country. We don't know when they are born. We don't know when they die. We are starting, but to what extent are you pushing to ensure that the data we have is accurate so that we can plan better for them? Thank you.
I'm Abraham, software developer. I think my question goes to all the panelists, and I'm just a little bit curious. Maybe let me just give a brief background where my question is coming from. So recently I participated in a hackathon by Zindi, where Makerere was participating. I think they kind of put a challenge there on, I think, malaria detection something. I don't quite remember it. And they kind of puts a bit of some data set that developers could use. Now, just a little bit curious, mostly to the health experts right there. How are you guys striking a balance between sharing healthcare data? Because I know for a fact healthcare data is very private, and there's a little bit of there's this thing in healthcare about confidentiality and all that stuff. So I'm just wondering, how are you guys striking a balance to avail data sets that can be used to train AI models?
Before the panelists get, I think there was only one specific question to Dr. Jingo. You will respond to that. I think the other two questions were to the entire, including you.
So first of all, thank you very much for the question. I think the way that I understood what you were asking is how organizations, and everything that happens within them in terms of their structure really going to align with taking advantage of AI. And I think technologically, there can be so many advancements, But what people sometimes forget is that technology changes organizational structure for you to be able to make the most out of that particular technology. And we all know that healthcare in practice has been the slowest in adopting any kind of technology, whether it's in diagnostics, whether it's in data or IT. It's always a very slow grind, and that's because people's lives and privacy and professionalism and licenses are at stake. And so there has to be, first of all, a high level of buy-in at a leadership level. And what that means is that leadership has to be very well informed and educated about what the positive net outcome actually is. Of course, there will always be some downsides, but at least there has to be agreement on positive net outcome. Because what that is going to mean is that what follows are key decisions to align with that positive net outcome. In terms of staffing, do you have the right talent on the team? How many healthcare institutions actually are very deliberate about having a team of software engineers and data analysts and infrastructure engineers thinking about, where their servers are being hosted or managed in the cloud or on premise, and things about data governance. It means that those institutions have to be very deliberate about who they give access to, how they share it, how they secure it, and how they eventually use it to the advantage of the patients and the organization. And of course, healthcare institutions also, well, for those that are on the private sector like myself, are under pressure to also make a profit. And because it's only by making a profit that they're able to be sustainable. So how are these technologies also going to affect our revenue and cost structure? Yes, they may be good to have and they may improve quality, but if it's only improving cost and not really having an impact on revenue, then you can definitely expect adoption to be very slow, if not impossible. And we've seen this with electronic medical records. We've seen this with interoperability. If there is no incentive enough for people to adopt and integrate these technologies within their balance sheets, then you're going to have a very difficult time, even if it's fantastic technology in and by itself. So I think as we look into integrating AI, we're going to have to see and really evaluate its impact across the entire breadth of the organization, from leadership, management, staffing, organizational structure. If it takes out certain processes, are there going to have to be some, fundamental changes that happen within an organization? And to be able to do this within an organization that already has incumbent structures or vested interests becomes another, kind of political minefield. So, yeah, there's a lot to really factor in. Some people will say that if you really want to integrate technology within an organization, you literally almost have to create a subsidiary that follows a different set of rules, processes, and objectives and visions separate from the previous entity, and eventually the new entity grows to a level that then cannibalizes the previous one, and you then kind of, it's like molting or metamorphosis, and finding leaders that are willing to go through that metamorphosis as a result of technology can be very difficult. So yes, the challenge is out there.
Right. The second question from Sabrina, how AI could potentially support the registration. You heard from Tony's presentation earlier in the morning the story of UBOS, still trying to figure out how to best address the questions that were asked. I think that's the context. So that's open to any of you, including Musinguzi, how you could potentially support that particular area. You can unmute and make your thoughts to the public.
I come from the same organization with Daudi, and I was looking at him, hoping that he probably has an answer. I think what I understood from Dr. Sabrina, she's asking that to what extent are we using national level data to inform some of the innovations that we are coming up with. And I think at IDI, we have, and again through the department that Dr. Jingo heads, we have appreciated the role of AI and its potential ability to do so much more, just like we've discussed here. And one of the things that we are doing currently, and I think Paul knows, is to strengthen our partnerships with the Ministry of Health, and probably also and widen our collaborations. Just like Ernest was saying, you know, data is the new oil, and so there's a lot of interest. So we have to build trust. But I think that also working collaboratively and openly will provide a lot of a greater platform to achieve so much. So we are thinking that we can't do this on our own. And for example, on the Makerere Hill, there needs to be a lot of collaborations between entities, and then, you know, networking with the Ministry of Health. And we're starting to have those conversations. I actually did talk to Rose this morning that, you know, we need to work a lot more together, and a lot more in a more collaborative fashion. And that gives us a platform of trust again that allows data to flow. But of course, right now, if you just walk into Paul's office, he's going to raise a lot of questions. But I know that he's also released a lot of data for people to generate different products. So I think that we are starting to get there. And maybe I can also respond in to the second question, which was about access to the data, given the privacy and confidentiality issues of this data. And I wanted to just say that in relation to this, I really applaud Mr. Mbaka and the team at DHI for, you know, translating the Personal Data and Privacy Protection Act into guidelines at the ministry level, because these have actually been launched, I think, this year. And they're available. And I think that provides a framework, a governance framework for us to operate. I think that the ground is now level, and there are already mechanisms that have been set for us actually to use data. Also, the Ministry of ICT probably is here. I know that they are working on the data use strategy, the national data strategy, and there's a lot of frameworks now available for data scientists to access data and use it to develop. So I think that Dr. Sabrina raises a very critical question for us to now, you know, step up and actually use population level data, because it's now available and there are frameworks that support us to do that.
Thank you, Ruth, for, I think you need to add something.
Right, I'll just add something quick for Dr. Sabrina's question. So one of the things I think that we need to think about is actually integrating the human resource itself. So typically what we have, as we do in this room, we do have physicians and medical doctors, and then we also have data scientists. But really, part of that process has to be integrating those two, which is to say that each of those different fields needs to be very intentional about learning skills and at least the general landscape of the other field, because in a very practical sense, it will be very difficult to station a data scientist in every clinic, or, you know, and the reverse. So I think that's one area which we need to pay attention to in terms of integrating these fields. Of course, academically, we superficially classify things into, I don't know, geography, biology, data science, but we all know in the real world all these things are very integrated, and we need to perceive them and handle them that way. So that's one thing. The other thing I think is also leveraging existing platforms to communicate about this data and how to use it. I think Dr. Sabrina is a vociferous user of social media platforms. And that's one area we cannot ignore in terms of, one, making these concepts and ideas popular, two, making them acceptable, and three, communicating real information about them.
Right. Thank you so much for your insights into those particular questions. Please kindly join me in applauding the panelists here for giving their insights into you have been really a wonderful panelist. Thank you so much, and have a great time listening to the next sessions.
Thank you so much, Mr. MC. Just like you've introduced me, I am Richard Malumba, and I'm the next moderator for this panel. And well, I would like to thank the previous panelists. They've quite done a lot to handle some of these questions. And the next one is going to focus on the foundation elements required to build a sustainable AI ecosystem. And with us today, I'm honored to present to you the panelists that are going to be with us to discuss this this afternoon. First, to invite Timothy Biekwaso. Mr. Timothy Biekwaso is the technology and innovation lead at Asili Fortune, a Kampala-based business technology consultancy, where he manages the firm's technology solution roadmap. He's passionate about aligning technology with organizational goals to achieve impactful outcomes. So I think they share the same interest with Dr. Musingu's there. His expertise spans IT strategy, product management, enterprise digitization, and data governance, with experience in sectors such as renewable energy, agribusiness, fintech, and EPC. You're welcome, sir. Next, we have Mr. Baker. Mr. Baker is an advocate. He's also the manager, compliance and investigations at the Personal Data Protection Office. He will be telling us what that means, and then he will answer our questions as well. But he's into much of regulation and implementing the Data and Privacy Act. You're welcome, sir. Next, we have Dr. Fred Kagwa. Dr. Fred Kagwa, you're welcome, sir. He is a lecturer at Mara University, Department of Computer Science. He's a researcher in data science for health, including big data security, biometrics. He's also the chairperson of Mara University Quality Assurance Committee and co-investigator of the Data Management and Analysis Core under the Mara University Data Science Research Hub. You're welcome, sir. Lastly, let us welcome Professor Peter Waiswa. He's an academic administrator. He's Associate Professor of Health Policy, Planning and Management at School of Public Health. He's a seasoned researcher with interest in maternal child health systems. He's also a visiting researcher at Karolinska Institute, Sweden. He also sits on the WHO Advisory Board for maternal, newborn, and child and adolescent health. But most importantly, he's my professor. So he's my teacher. You're welcome, dear panelists. So we've had quite a lengthy discussion with the previous panel, and they're talking to us about how we should use the data, what we should do to ensure that we have an ecosystem that is, good for us, that is going to yield positive patient outcomes. And in this panel, we're going to be discussing really the fundamental elements that are needed to build such a system, most especially looking at the uniqueness of our setting. We are resource constrained, but then we need to have this going. Dr. Ruth said that AI is still a child, it's young, it's growing, but then we need to prepare for this child. We need to provide housing, we need to provide the basics that it needs to grow, to work. That's what we're going to be discussing this afternoon. So as I take my seat, I will throw the first question to our panelists. So Africa's healthcare challenges are distinct from disease burden patterns to the resource limitations. But how can AI be tailored to address these unique challenges rather than relying on imported solutions? This can go all the way. All you need to do is just open your mic, and then we start the discussion. Yes?
Thank you, Richard. Is that specific to anyone or?
Yeah, anyone. But you can go first now that you've opened your mic. Thank you.
Okay, thanks, Richard, once again, and the speakers that have helped shape the context of this very typical conversation today. I hope I can be heard. Generally, we do believe that building a sense of community is not only fundamental, but also it's an imperative for us where we are at this stage, which is why I reserve enormous credit, and I'm sure many of you do, enormous credit and gratitude even to partners like the Makerere AI Health Lab, among other AI working groups and stakeholders that are leaning in this conversation and these practices. Building a sense of community, and I think it's critical that everybody in this room appreciates that building a sense of community really does represent the intersection between three core aspects of our undertaking as an ecosystem. And I think the first is purpose. I'm sure Dr. Rose and her team have purpose at the core of what they're doing, as is the case with other stakeholders. So purpose being the first one, shared goals being the second aspect for us that is critical, and then finally the rules of engagement that guide our participation in learning and adapting to this new technology. I do think, Richard, if you may, that this question can also be addressed from an inverse perspective, in that AI initiatives need not to be what necessarily foster collaboration and partnerships, because as we've seen through the adaptation and the proliferation of new technologies over time, it is something that necessitates it. And so to speak, both the AI adaptation and its proliferation still remains subservient to the notion of the increasing density of computer chips. Moore's law, I think some of you may understand it as Moore's law. Where we are now, that's not going to change, and I think if we have any anthropologists in the room, they will appreciate better that this typically is what defines wealth creation, career creation, and not the wealth creation in the context of our socio-political construct, but wealth creation in terms of how, as mankind or as humans, we generate value or economic productivity. So I think to answer the question, first I think I would like to paint that context. But speaking more specifically to how collaborations or partnerships can be fostered in the ecosystem, I think it's critical that we consider the foundational elements that have been discussed since the morning. Things like robust infrastructure, sound policy frameworks, the skilling element as well, and even our reason for being here, the interdisciplinary or intersectorial collaborations. These four, I would suggest, are foundational elements, which we can come back to later in detail, that are very critical for us to create an ecosystem that is sustainable, really. I'll take it back to you for now.
Thank you. Thank you so much for that response. And you've mentioned something that is so pertinent of late when it comes to health interventions, that is community engagement. Dr. Kagwa, how can AI, how can local communities be engaged in co-creating AI solutions to ensure that they are culturally and contextually relevant in relation to community engagement which Mr. Timothy has spoken about as one of the fundamentals. Thank you.
Yeah, well, hello. Yep. I think I may need to hold it as well. Thank you, Richard. Well, do we know what the community needs? That is the first thing. So we need to co-create, and co-creation is creating something with one or more people. Now, we cannot have AI solutions work when we are building them for the community. So that is one of the wrong things we are doing. Lots of solutions are coming up for the community, but not with the community. And that is really, really critical to start with. And then, two, do the communities understand what the AI is about? Do we have some education programs that are running through these communities to just give them awareness and trust in the AI? So that is also really, really critical. For us to be able to bring on board the community, we must sensitize them, we must work with them to be sure that at least everything we are doing is understandable to them. So if we are to design applications, we also need to co-design. Do we have the local health leaders? Do we have them participate in the interviews or discussions that are going to generate these AI solutions? Or we are imposing solutions onto them? We know it better. That's the idea that we always come with as academicians or as tech people. We always have this mind that we know what you want because we also live in the same environment. But the challenge is we may live in the same environment, but we're not surfacing or we are not linked up to the same areas that other people are working with. So we really need to involve them, bring them on board, and make sure that at least we get their experiences and then have this work together. One interesting thing is we are losing the indigenous knowledge. And this is actually one of the areas that we actually need to engage more. The communities will actually come on board. There is indigenous knowledge that we can generate and have this in the knowledge databases. And so as we are developing tools or AI solutions, they are going to have the people's experiences, the local experiences. And at the end of the day, they are getting involved in providing solutions. Someone earlier on talked about asking ChatGPT to give you in a local language in terms of a particular aspect. So when these indigenous knowledges databases are developed, then we know that we have AI that is collaborative in terms of involving quite a number of people. So basically we need to work with the communities. If we leave them out, we shall really miss it out.
Thank you so much for that response. And you clearly show that two kinds of people have to work together. The local person, Omuntu Wawansi, but also the designers, the creators. So what specifically will you tell Ernest, who is developing a solution, to do in that regard? What should he do for a person who is in Katanga, for example, because they need to get involved? Where does he start? What does he need to do?
Yeah, thank you, Richard. Ernest, we need to go down to the Omuntu Wawansi and reach out to them. He should not think for them. He needs to go down, have maybe community engagements. There could be communities. We have a well-structured country, by the way, that there is a structure in the health sector, for example, which goes up to the VHT, who goes to the village. Now that we are focusing on health, the VHTs go up to the village level and they know where everyone is, and they should be able to tell the health issues down there. So as a co-creator or as an AI developer, they need to get down to the people. I think the bottom-up approach would at some point really yield more inclusiveness in terms of picking out what the people down are going through and making sure it is well represented. So going to Katanga would be very good, and have maybe focus group discussions, maybe community engagement, and real observation of what is going on, rather than assuming or rather than getting a satellite of what is going on. Visiting the place would really be very important, and the people would feel that you are with them but not for them just. But yeah, it is not enough to be for the people, but it is also important to be with the people. Yeah.
Thank you so much. Turning to Prof. Prof, I know that you have a special liking and interest in maternal and child health. What would be the gaps that you've identified that probably you will tell Dr. Rose and probably the rest of the developers like Ernest for the assistance? What would be those that you would report to them that you require solutions as you try to improve child and maternal and child health in Uganda?
Yeah, thank you so much. What I would tell Rose and team is, one, the healthcare is very complex, and like Mr. Mbaka explained, it is very regulated. So to begin with, I always ask the question, what is the problem that you are trying to solve? Whose solution is the AI? So until you answer that question properly, it is not easy to develop an appropriate solution. So understanding what is the problem that you're trying to solve. And unfortunately for healthcare, a lot of this is regulated by policy and alignment. But like one presenter said, sometimes we need to disrupt these issues in order to leapfrog where we are. I could give one example. You know, we are a country of young people, many children, and they say they are the future. But also we have a lot of stunting. Almost 1 in 3 children in this country is stunted. And we say that if you are stunted, you cannot achieve your human capital potential. So this is a big problem that we need to be addressing. Now, without understanding the problem, so we need to characterize these problems and say, are they also the priorities, let's say, for the health sector? So that's a very important part. Now, developers alone are not actually able to do these solutions without the technical experts in those areas. So they need to work with health workers, and also I must say, like somebody has said, also with community members, and of course other people, because even health workers alone do not have the solutions. So that's important. Finally, I think this issue of complexity of healthcare, and I would like to pick up one example, which is in the room, diagnosis for malaria, which is very important. But actually treating malaria might save a child, but that child tomorrow might die from something else, maybe from anemia. So if there was a solution that is integrated, then most importantly, you are going to be able to help this health worker, but also to give the right treatment for a child. So we always think about a diagnosis as not singular, like just malaria, but maybe what else could we do? And could we integrate maybe prevention? Because that same child may not also be immunized. So technology alone may not solve the problem, but actually we need to understand the problem. So understanding the problem, which is this child surviving, and you want the child also to thrive. And that requires to understand complexity and how to deliver it. So technology can actually contribute I think like Dr. Davis explained, to solving part of the problems so that the health worker can focus on some of the other issues.
Thank you so much, Prof. And in there you mentioned the point of integration. And this, of course, calls for skills. So for the guys in, in Kampala, in some of the labs, they have the skills. Probably they can even do better integrating these. But how about the rural area? How do we bridge the skill set gap that exists, utilizing AI and integrating it with the delivery of healthcare, routine care, that is? Thank you.
So actually, rural healthcare, which is for our country, represents over 70% of the population. I usually say it's characterized by vulnerability. In many ways, they are illiterate, they are poor, they actually are very far from everything. They don't have electricity, and many times they can't also afford the technology. And so if you are to find a solution, understand that context, like I said, understand the problem becomes important. If we can find solutions which can work for them, that becomes important. For instance, if they are literate, then like you can use voiceovers. Some people are developing such AI solutions. Two, can we do solutions that are in the local language? Now, some people say we are one of the most diverse countries in terms of language. So how do you do an innovation that somebody from where I come from, Busoga for instance, understands? But in that same setting, actually you'll find people who speak Ateso in that context. So we need to do a lot. I think our challenges are much more, but actually AI solutions can help these people, and we integrate. Then I think it's also been said in the early sessions, sometimes you want to refer because you have a condition that you may not be able to solve. And those kind of system linking to people who can provide more help is important. And sometimes we say we can use virtual systems and stuff, but in the end, we must integrate the technology plus the skills of the people. So as we do the solutions, we must know that, yes, technology is one part, but also in the end, yeah, somebody talked about robots and stuff in the morning to do surgery, but I think we are not at that level yet. The robot here might actually be the human being, and the technology is helping with the diagnosis and some of the other things like maybe follow-up and counseling.
There's something it touched which is really important in terms of providing equity for technology access. Most of the current AI applications or solutions are actually focusing on smartphones, and we have the 70% health sector in the rural, which really draws attention in thinking through what low-cost technologies can we think of in terms of using the USSDs, the SMS or the voice, which someone alluded to earlier on. So this is I think really important. So the developers here, I know I have accessed quite a number of tools which really cannot operate in typical rural settings. So we need to think of low cost solutions. They are still AI, but they are low cost, and maybe they actually do not also demand a heavy load in terms of data or internet. This supports the local person in terms of acceptance, usability, and taking on AI. Yeah, thank you.
And of all the solutions, rather the responses that have been given, you've also talked about the local solutions, other than the mobile phone, the USSD and all that. But all those need a digital structure, so to speak. Mr. Baker, how can such infrastructure be availed? Infrastructure that is sustainable, that is accessible to every user, or to every developer for us to have a sustainable AI ecosystem?
So for the solutions, I'll start from speaking from the government perspective. I work with the Personal Data Protection Office. I thought with my height I can be able to get it without lifting. Okay, clearly there is an issue. I need to hold it. Okay, so I work with a government agency that collaborates with the National IT Authority. I work with the Personal Data Protection Office. It's the regulator and implementer of the Data Protection and Privacy Act in Uganda. NITAU, the National IT Authority of Uganda, has infrastructure that can support, and they actually have programs supporting elements to do with hosting needs around AI. And what are some of these needs? So definitely AI being foundational with data, that data needs to be hosted somewhere. So the commercial off-the-shelf solutions are usually expensive, so the innovators, it's out of reach for them. But government has a national data center, and as it is with any infrastructure, especially with hosting, you have the main area for the data center or storage, which should also be mirrored. Mirrored in the sense that you have a backup. So government already has that. The data center is in Kampala, and the mirror, what we call the disaster recovery that can be used, is in Jinja. Government heavily invests in it. So how it can actually be used is creating solutions and offerings for these developers where they can get hosting free of charge, others at a subsidized cost. So that is also one of the ways that can be scalable. But the earlier presenters talked about the power issue in Uganda. We all know it. So the surge power is also expensive. Solutions have been also developed, greening, whereby now using also solar, there is a loan which has been, loan and a grant been granted to NITAU to scale up this data center and have solar panels used in ensuring that it's up and running. Data centers are very expensive to manage. So if you're relying on the usual hydropower, one, it's unreliable, it's very expensive. So that means you either have to use the fuel. The fuel is equally very expensive. So with that, using the solar, it will make it more sustainable. But just doesn't stop there. The other challenge that we've seen, especially in Uganda, that those that come up with these solutions, you know, they don't know that the solutions need not be targeting the Ugandan market only. So when you come up with an AI product, then you may consider someone within the region or even Europe. And with them, they are very concerned about data protection and privacy. So the regulatory framework can also support. Good enough, the office where I come from, it implements that law. And Ministry of ICT has also developed the national data strategy. Now that strategy is to ensure that beyond the personal data, data is thought about. People think about how to create value, the challenges that the earlier presenters talked of accessibility, sharing, now they will be addressed within that. So that when these solutions are actually built, they can be used by other countries, and that assurance is given of the existence regulatory environment, but also of the solutions. I'll end with something mirroring at the regional level. The East African community is also coming up with a strategy around data. So this strategy will ensure that infrastructure is available, still speaking to what's in Uganda, but it doesn't stop at just the East African community, which has 8 partner states, but also at COMESA, which covers a much larger part of Africa. That way, these solutions, they can be developed locally, served regionally, but also even scaled internationally. Thank you.
Thank you so much. Now, one of the panelists earlier mentioned that data is a bit a complex thing. It is there, but it is also not there. Today it's in Canada, it can move to the US, to Uganda, and all that. And surely you're from that office that regulates. I mean, we also know that the different countries have different policies that are regulating and managing. And of course, when you come to Uganda, we try to have policies that are tailored to our own setting. As a regulator, how are you going to address that challenge? That today we share data with colleagues in maybe Kenya, even in Canada, but then we don't have the same policy frameworks. There are some changes. How do we handle that? What is your office looking at to have that solved?
So that challenge, it has been observed from the regulatory requests on interpretation of the law that we receive. We track them. In the last year, we received over 100. But realize of those requests on interpreting the Data Protection and Privacy Act, 60% of them were on that particular question of how do you align with another country. We've joined forces with other countries, starting with the East African community. East African community, a study was done and realized that the laws are largely similar, but when it comes to cross-border sharing of the data, the challenges are immense. So a regulatory framework will be developed. They're going to develop an East African Data Protection Act, which will work in a way that all the acts say that so far there are 5 out of the 8 partner states, they will be superseded, and that it will make it a lot easier to share and move data across the region. But it doesn't stop at the East African community. At the continental level, there is an agreement called the African Free Continental Trade Area Agreement, AFCTA. So it's an agreement, and it's one of the widely adopted agreements on trade in the region. Close to over 97% of the countries, including Uganda, they've signed it. So it's making it easy that if I'm in Uganda, I can sell my product using electronic platforms to someone in Cameroon, and I can also do the same with someone in South Africa. But because Africa has those separate laws on data protection or data management, it has what are called protocols. Protocols help in implementing that agreement. And of those, there is one called the Digital Protocol, Digital Trade, and specifically around cross-border data transfer. So there will be a committee set up, and it will ensure that it's actually done seamlessly within Africa.
Thank you so much. Mr. Timothy, collaborations, partnerships, a fundamental element if you want to have a successful, ecosystem. However, what AI solutions or interventions can be thought about that can bridge the gap or that can bring together the tech companies on one hand, we have the healthcare provider on the other, then we have government or regulators?
Thanks, Richard, for that. I think first and foremost, in interrogating the question, that is something that invites us to look beyond simply the new solutions or the new approaches to problem solving that we are going to come up with because of this new technology, but also make very, very critical considerations with respect to scalability, affordability of these solutions, as well as the ethical alignment that is really, really critical. So in terms of what AI solutions, I think it's an open conversation. The principal of the College of Computing, I think, rightly pointed out, for instance, earlier in the morning, that we've got to look, for instance, beyond computer vision and look at the other applications within that domain that can help us leapfrog some of the challenges. I think closely to this, I would invite us to also think about these foundational elements, through the limitations that have us Africans on the back foot, as I said earlier on. And I think the reason this is important, especially for purposes of this discussion, I choose to interpret these 4 foundational elements as competency areas, if you like. And the reason for that is the collaboration and the partnerships that are very relevant for us lie within or between these areas. In terms of infrastructure, I think we've had the conversation, rather the reassurance from some of my esteemed colleagues in government in terms of fulfilling, for instance, the digital connectivity, high-speed reliable internet. That these are very critical in the infrastructure sense in making us realize the full potential of these solutions. But besides that, of course, computing power and data centers, a role that private sector players as well as government have to play. But moving from that, again, in relation to the solutions, I think one thing I want to chime in, my colleagues spoke about skilling and the human resource element that has been emphasized since morning. I think it's critical generally that we nurture certain skills in children, and this is not specific to IT people or other practitioners in this sense, but think about, for instance, critical thinking, which, if you think about it, I think is very, very important with the new age we are going in, whether it has to do with having an individual nurture the ability to discern misinformation that is generated from AI efforts or AI tools, or even a user of a product on the market or a service, an AI-driven service, to be able to discern between the marketing buzz of a solution that actually works and addresses an issue, and simply a product that may be put out there, as my colleague mentioned, without considerations of diversity and conflict, key ingredients of any innovation, so to speak.
Thank you so much. Now back to Mr. Baker. For interventions to be successfully implemented, we have to take care of the societal values, culture, and things like that. What regulatory frameworks are you putting in place to mitigate, abuse to that regard, societal values, culture, but as well as not to prevent or not to stop innovation when it comes to developing AI solutions?
Mr. Richard, just sorry to cut you short. Just allow me, let us observe the protocol as we welcome our peers. Let's just stand up. PS comes in. Thank you all. We shall continue the discussions, and then thereafter we are going to listen to our Permanent Secretary, Ministry of ICT and National Guidance.
Thank you so much, MC. You are welcome, our dear guest. So, yes, Mr. Baker. The question was, for any successful intervention to be implemented, or for any intervention to be successfully implemented, we have to bear in mind, or we have to take care of societal, aspects, values, and culture. What regulatory frameworks are you putting across to put that into consideration without, curtailing innovation, but also, fostering the implementation of AI solutions?
Thank you. For that, I'm going to use an example. The AI solution that the Personal Data Protection Office adopted, because yes, PDPO is a regulator, but it's also in the same sector. So when the office was operationalized in 2021, being a regulatory body, so it implements the law and receives complaints from those who believe their personal information has been mishandled or misused. We created a lot of awareness And in the second year of implementation, we we came up with a website where individuals could get information, and then we used the USSD SMS platform for them to be able to complain. Within a week of having that, we received over 1,000 complaints. Then by the time we reached 2.5 years down the road, the complaints had reached almost 10,000. But the number of employees and those engaged in the office didn't increase to the same level. And we had a number of challenges. One, the law requires us to receive the complaints and resolve them within a particular period of time. And of course the public, and this is not in any way to crucify you, they say, but this government doesn't work. You know, you complain, they can never understand the challenges. So we needed to come up with a solution to be able to address it. So we looked at the environment, of course looking at the law, starting with the Data Protection and Privacy Act, that if we are to adopt AI to be able to manage this challenge, are we allowed and what limits within which we can operate? And good enough, the law already recognize use of AI. There is something called automated decision making, that if you are to use automated decision making in any of your processes, then have an element of human intervention. So we noted that, but then we also looked at the Electronic Transactions Act. It was enacted in 2011. It's part of the set of what are called the cyber laws. There is that Electronic Transactions Act that allows, as a government agency, to be able to communicate online and come up with such solutions. So having looked at those, we worked with Sandbird AI, Ernst is here, and we understood and said, okay, we want to see how we can quickly categorize the complaints and resolve them. And the solution, they helped us develop it. But like the other panelists have been talking about, you know, understanding that context, because for them, they are the developers, but we had the legal, but then we also knew the environment in which we are working. So if it's someone is having a feature phone and they're interacting, what could be developed? If it is someone from a more sophisticated background, all those that was put into consideration. And the complaints, regardless of the number, they could be categorized in almost about seconds. So it increased our productivity, having understood the different people that we serve, someone in the village, in an office, someone in Chikubo who is just concerned. And with that, we're able to realize that many of the complaints were actually about a particular government agency handling data, and we're able to engage them. But then it also helped us to fine-tune, because the solution needed to be taught, understanding the Ugandan context, the expectations. So using that regulatory environment, human interaction, we're able to develop a solution of AI to resolve the complaints, but also to comply with the law, which I encourage the rest that, you know, they take up the same methodology if they want to develop something. And of course, it became more effective.
Yes, as Dr. Kagwa comes in, how do we build the trust then?
So building the trust, still with data protection and privacy, there is a principle called transparency. That if you're to deploy AI solutions in your operations, even if you're private sector, the law requires that let individuals know. Because within the Data Protection and Privacy Act, it says, if decisions are to be taken that will have an impact on the individual, people, what we call data subjects or the individuals should be notified that AI was involved in coming up with something. But if you want to appeal or talk to a human, there is a phone number, an email address, a person you can interact with. But we also let them know that, you know, this is something which we actually keep improving. So individuals know that something is being done, and whichever decision is taken is based on a solution, and they even have an avenue of speaking to a human, it increases their trust.
Thank you so much, Dr. Kagwa.
Yeah, well, trust requires, of course, transparency, like he just said. We need to explain these AI tools to the people, which data they are using, and of course the privacy measures that we put in place for protection of the data. But well, I wanted to comment on something earlier on he said, where they had 1,000 and later on 10,000. I think one of the core aspects that we need also to think about is the sustainability of the ecosystem. Who are we creating this ecosystem of AI for, and how are we going to make it sustainable? If we do not have sustainable feedback mechanisms, it will die out. Let's say, for example, you have a grant, you've done very good work, very nice solutions. When the grant ends, there's no more feedback. Yeah? Let's say the government has put a lot of infrastructure, it is working, and etc. They did surveys and etc. But there is no continuous feedback coming from the communities, from the towns, from the cities. Then it's useless. And one very core aspect for AI to help us, to improve us, it needs to learn. AI needs to learn and learn and learn and learn. And it cannot learn without feedback mechanisms. So for us to really have a sustainable ecosystem, we need to also have sustainable feedback mechanisms that really can support this. Feedback is a very serious backbone for a sustainable ecosystem for AI.
Thank you so much. Prof, lastly to you. For this mother who has a child and she has gone to a health facility, how do you prepare her for these solutions, the AI solutions?
So for many of the mothers, and I must also fathers, and maybe the entire community, they actually don't trust so much gadgets. And but it depends on the issue. Some issues are so personal. So if you have a gadget and maybe things about sexuality and things like that, then you must explain to people a little bit more. And because they want to know, what are you doing? Where is this information going? How is it going to be used? People are also political. And there are so many issues. So I think the issue of, like I said at the beginning, understanding the context, understanding our population, and being able to explain to them, that must be the first thing. In Mackay, in Iganga, we have a demographic survey site where we've been using gadgets for maybe 15 years. But when we introduced the gadgets to collect data, we had to do a lot of engagement, starting with the leaders. We even had community advisory boards who would resolve some of the issues. And then, like they said, feedback becomes quite important. So explaining to people, I think is a must. And then training providers. We talk about respectful care, that most health workers, and this is one of the problems with technology. Sometimes we focus a lot on the technology and we remove the human aspect. So we must see how do these solutions integrate issues of human communication and emotions.
And lastly, Dr. Kagwa, how do we move forward from here, from this conference? We want to build a sustainable AI ecosystem. What are our next steps?
Well, I have quite hinted on a number of points, but like I've said, the infrastructure, we have been assured there's some kind of infrastructure from government. We have the researchers, we have the partners, we have funders, we have loans all over the country. But how do we collaborate together? If we are in silos, we cannot really have an ecosystem. Before COVID, we suggested an ecosystem which is published at Harvard Medical School. You can look it out. And without that collaboration of all of us incorporated, if the government is working alone and thinking by itself, the academicians actually are not feeding in the government most of these AI plans, because lots of works are being done. There's lots of solutions out there. If the government can move out and see the different universities, what they are working on, the different institutions, what the research institutions, the things they are doing, they're tremendous. There's a lot of AI moving out there. Actually, there's need to expedite the frameworks that govern AI usage in the country, even in the universities themselves. But of course, collaborating and working together is very important. But for us to keep it sustainable, we must keep the feedback loop continuous. Otherwise, it will die out. Thank you.
A feedback loop. Mr. Baker, from the regulation and policy side.
To what he said, collaboration is very key. It has worked for us as the Personal Data Protection Office. So it's just to us, academia especially, to be more involved. Where guidelines, regulations are shared, please share comments. Make sure that you put in a bit of time. That way, it can inform the regulation and policy. So it's basically about more collaborations.
Thank you so much, panelists. Our audience, our panelists have been Dr. Kagwa, Fred, lecturer, Mbarara University, Department of Computer Science. Mr. Timothy Biekwaso, who is the Technology and Innovation Lead at ACIDI 14. Mr. Baker, who is from the Office of Personal Data and Protection Office. And Professor Peter Waiswa. Thank you so much, panelists. We may resume with our seats. Thank you so much.
Let's give them a round of applause. In the meantime, they're going to take a picture. Just line up and take a picture. As they do that, I'm going to give a gift to someone who answers this question. Please ensure the microphone is moving around. So my question is this. In Africa, we say it takes a village to raise a child. With AI in healthcare, who can finish that statement? I need 2 or 3 people. In Africa, we say it takes a village to raise a child. With AI in healthcare,
with AI, it takes a multidisciplinary team.
It takes network, collaboration, and innovation.
It takes a multi-sectoral collaboration to create a sustainable ecosystem.
It takes the whole community.
It takes the village out of health.
Oh, my God, my God. Repeat with me. Co-collaboration, co-design, co-partnerships. Now, from everything I've heard since morning, we've been talking about these things. How do we collaborate? How do we partner? How do we design together? It takes a community, it takes ABCD. So all those things, put them together, I think we are headed somewhere. So I would like to, with that icebreaker, nobody got it, so I got it right. So, yeah. Allow me to introduce the next speaker. Just before she comes, I'm going to read something about her. She is an experienced IT professional, passionate about embracing digital transformation to improve business models, service delivery, and transform people's lives. She provides strategic and technical guidance on how various sectors can leverage innovation, digital solutions to solve their problems within academia, government, and in the private sector. To this end, she has played a big role in strengthening the linkages between academia, industry, and developing policies, strategies, and program documents for funding partners that align IT with government development agenda. She has specialty in business process re-engineering, systems integration, e-governance, and information security. Allow me to introduce our Permanent Secretary to the Ministry of ICT and National Governance, Dr. Amina Zawede.
Good afternoon to you all. Good afternoon to you all. I bring apologies from the Minister, the Honorable Minister of ICT and National Guidance was supposed to be with us today. However, due to conflicting clashes in our programs, we have got some emergency meetings that came up, and he can therefore not join us, but I will ably try to represent him. First of all, I will not go through the many protocols. I'll ride on the protocol that was observed earlier before I joined. I'm very certain there was a protocol that was followed in the interest of time and not standing between you and lunch. But I will recognize so many faces that I know and colleagues from academia. My heart still belongs to academia. I breathe academia, and it is what butters my bread. So I really appreciate you for having been able to pull off this, emerging trend that everyone is talking about today. Artificial intelligence, and what a best way to start it than to have it in health, which touches everyone's heart. The AI in Health Africa Conference, for those that are coming to join us from outside Uganda, you're very welcome to Uganda, to the Pearl of Africa. And I pray that you get time to look around and appreciate the beauty of our country. I also appreciate the partners that we have had. The MC before he left told us AI is about co-design, co-partnership, co-collaboration. I don't know about co-collaboration is so many cos, but yes, we are collaborating and partnership. So I really appreciate the partners that we have on this, that have helped us to have this conversation of AI in health. That is my own ministry, the team from the ministry. I appreciate you. We have Google, I'm reading them from here, Lacuna Fund. My student Rose is working on the Ocular project. Please stand up for recognition. Rose, Dr. Rose Nakasi. Dr. Rose Nakasi is my PhD student, so I pride in having supervised her together with my colleague, Dr. Ernest Mwebaze. Also, please stand up because this is our product to celebrate. They say it takes, please sit down. They say, yeah, the MC said it takes a village to grow a child. It took us to grow Rose, and Rose has grown this community. So we thank you very much for that. Artificial intelligence is one thing that is currently at the heart of government. This year, around, I think it was August or July, we had a retreat, a cabinet retreat of ministers and permanent secretaries, a 1-week retreat. And out of that retreat, we were discussing so many things, including digitization. How do we accelerate digital transformation in the country? And out of the resolutions that we had was that we have to develop an AI policy for government. And they want it like yesterday. Everyone was talking about artificial intelligence. So please, the people who are here today, government is no longer lagging behind. It used to be, academia at the forefront of so many findings, so many solutions, and then they would collect dust on the shelves. But today we are embracing all the solutions and technologies because we believe that for digital transformation to grow, we have to come up with solutions that are sustainable. And we have to come up with solutions, and you can only come up with solutions that are sustainable if you know the environment you're working in, and you put everything into context, right from the ease of use, the costs, you know, how are you going to train people to use and adapt? So you can only do it if you are in that community, and we'll come up with a solution that is relevant. We are gone are the days where all solutions that we're bringing in were imported solutions, off-the-shelf solutions, from so many vendors. Today we are vendors of our own. We have developed solutions even out of AI context. But particularly in AI, I think AI started over 10 years ago. 10? I think even 15. 15 years when Ernest was doing AI for Cassava. It was over 15 years ago. We started doing AI for, you know, for crops, for agriculture. We moved to AI for health. We have done AI in education. We are doing AI for tourism and AI for so many things. So it is the talk of the day now. As I speak here today, I know media is covering this event, but every Ugandan wants to appreciate what we are talking about in a language that they best understand. And we already have these solutions, AI-driven, that you people have, you know, developed. So transforming the potential of AI in healthcare cannot be deniable, in particular for health. It is being used to improve diagnostics of diseases and improve diagnostics of patient care, as well as determining what health disparities that we have. AI provides us with unprecedented opportunities to advance our healthcare systems. And as a country, we are very well aware of that, but people ask questions day in, day out. Some do not know what AI is. Others do not know how to appreciate it. Yesterday, the Ministry of ICT is leading the digital transformation program, and we were presenting the performance of a digital transformation program in terms of having implemented the NRM manifesto. Now, the NRM manifesto has some directives related to ICT. So we were accounting to the public, what have we done in so many facets? What have we done in terms of connectivity, in terms of infrastructure, in terms of mobile phone penetration, in terms of internet usage? And then questions came up from the, you know, from Ugandans. What are you doing about AI? How are you going to regulate it? You know, and what are you doing about cybersecurity? These are the questions now Ugandans are asking. So it's no longer questions for academia, but it's questions that everyone wants to address. And as a Ministry of ICT and National Guidance, we believe that governments play a pivotal role in creating an enabling environment that nurtures innovation, attracts institutional support, and ensures sustainability. We cannot implement whatever recommendations have come up here that I listened in from the panel without partnering with all the stakeholders, different stakeholders. If we are talking about AI in health, we have to skill people. You can't do without the education system. You can't do without academia. You can't do without government itself, the private sector that is going to support us in rolling out some of these solutions, the development partners that will help us do work with experts or do knowledge transfer and even funding as well, the civil society, the communities, and the different sectors that we have. So our role as government is to establish the conditions that are required for this to happen, and then come up with the right policies, right regulations, guidelines and how to enforce these. As a country, we are very good at coming up with policy documents. Believe me, even with this AI policy, it is going to happen. But then we fall short of implementation, we fall short of follow through and enforcement. That is why things go wrong. But since I have the majority of this audience, I have looked around and seen a number of you are researchers. I would like us to consider, as we have the engagements and collaborations about the policy, let us also think through the implementation strategy for this policy. So that by the time we are having a policy, the strategy is in place, we have looked at all the risks that one would encounter as we do implement and even come up with proposals for recommendation, then we shall move very fast. The ministry, through the Ministry of ICT, government now has a national digital transformation roadmap that has prioritized what we need to put in place for us to accelerate digital transformation. Artificial intelligence does not fall out of the scope of that digital transformation roadmap. For us to grow AI, you need infrastructure. And the first priority of our roadmap is expanding digital infrastructure, making devices affordable and accessible, and looking at penetration of internet usage across the country. And this is all that you need all these. We are also conversant of having the right enabling environment. That was not prioritized in our roadmap because as a country, and we are not saying it's not important, but prioritizing is what are we looking at in the next, or where is our area of focus in the next 5 years. We assessed and found out that what it takes for digital transformation to grow is one, an enabling environment. You have the laws, policies, regulations, you have infrastructure, you have digital services, you have skilled your people, you have invested in innovation and entrepreneurship, and also you have taken care of things to do with cybersecurity, data protection, and all that. But when we looked at our enabling environment, we have very good policies in place, very good laws in place. Of course, the artificial intelligence policy is now going to be also a part of those. And even our neighbors have taken these policies as is and implemented and, done so well. So we said now our focus should be on enforcement and seeing how we follow through these various policies and regulations. So we were, and when we did a dipstick analysis on how we were performing at about 77%. So Uganda is doing very well. 77% in terms of having the good policies in Africa is a very good win for us. So clap for yourselves as a country. Then, so we now prioritize digital infrastructure, digital services, taking as many services online as possible. And of course, AI solutions are some of these services that we are looking at. If you have services online, there are so many advantages that come with it. You operate efficiently, effectively, you can account, you're transparent, you have data that is going to inform decisions that you make, and so on and so forth. Then we are also prioritizing cybersecurity, data protection, and privacy. And along that, I think now AI has also become part of those priorities. Ensuring that the systems that we are developing or applications are secure. We have created awareness campaigns, and so that people know what it means to operate in a safe digital space, while protecting the interests of people through data protection. Then we are also prioritizing on that roadmap digital skilling. Digital skilling is very key and essential. Some of these solutions that we are talking about for health require, if I may recall, Rose did research of improving optimization of diagnosing malaria parasites. You know that we used to use microscopes. Now we have gone high tech and are using mobile phones or applications to do this diagnosis. So she was improving the optimization of analysis of those malaria parasites. Very complicated biology terms, but what she had to do was to train lab technicians on how to use the devices she was using, and also on how to do the various analysis they had to do. So if people don't have the skill sets to run the devices or run the applications, then adoption will be very low. So that is why we are emphasizing skilling at all levels. AI is more specialized, but even the basic skilling for somebody in the market, to maybe a farmer or a market vendor, to identify which hospital they should go to, or if there is an app that is able to do a blood sample analysis, for them to do that, it requires that you have to have a number of skilling campaigns to be able to cover the skilling gap. And then lastly, the priority number 5 of our roadmap is innovation and entrepreneurship. Given that we are a young country, for those of you who have listened to my speeches, I always talk about the population of Uganda. As at the last census, we are at 46 million people, and 77% of these people are young people below the age of 30. And our population is now at about 16 to 17 years old. Do we have any 17-year-old in this room? So all of us here are outliers, or are in the 30% of the population of this country. But the good thing is that we are switched on to deliver solutions for these young people and know what to do to support them. For those of you who are in academia, it is very important for us to, because Ministry of Education has changed its curriculum now to be able to embrace digital transformation. But also you at university level, we have to be more intentional. When I was at university, we used to have capacity building, projects. And I think everyone at Makerere now has a PhD or is doing a PhD. It is normal to do it. So capacity was built for staff at the university to be able, first of all, it was, yes, building their capacity, but it also gave people exposure on different environments, different countries, to come back home and implement. Now it is your duty to also, give to the students what you got back. In this era of artificial intelligence, how are you going to bring, practice better to your students? How are you going to ensure that people don't look at AI as only for College of Computing, but it is applicable everywhere. It is applicable in education, in health, and so on and so forth. What we have done as Ministry of ICT to be able to accelerate this transformation, we have encouraged Ministry of Education and guided them to ensure that every teacher that qualifies from a teacher training college or from university comes out with a certification in digital skilling. And why are we saying that? Because we have so many teachers today who go to class and the students are even better than them at using these devices. They don't know whether the student is using it safely or not safely. So we want to teach them to be on top of their game as they engage with our students and our children. So that is one thing that is going to happen, because what is currently happening is that IT is seen to be for computer science people only, or College of Computing only. Now we want it to be spread across the board. And then all the solutions that we are talking about here today, even the ethical ways of dealing with artificial intelligence, will be better appreciated if everyone is educated. On innovation, we are very aware that we cannot flourish without skilled individuals to drive it, and therefore government has actively integrated AI and digital literacy into our education systems. Still on paper to a large extent, but we are doing a lot of training here and there. The reason why I came late today is that we had an earlier event. The International Telecom Union has been partnering with us, and the Chinese government has been partnering with us, the Ministry of ICT, to train people in various emerging technologies. Artificial intelligence was one of them. And cloud computing, augmented reality, and so on. So there are a lot of efforts everywhere, but it's still thin. We still need to see the impact in a big way. So if we come together with the slogan of collaboration, partnerships, and co-design, we are going to see the impact grow. Now, to our health sector has also benefited a lot from ICT advancements. We have seen telemedicine platforms and digital health solutions such as the DHIS2 that is being used under the Ministry of Health. We have enabled remote healthcare delivery and also improved disease surveillance and management. These innovations are helping to bridge the gap in healthcare access, especially in rural areas. And some of these solutions were initially, for example, the DHIS2 is not a locally developed solution, but we have developed the capacity to develop local solutions over time, and we are going to grow these to even take on artificial intelligence or do generative AI for us to produce better and more precise results. In other sectors, we have grown some own homegrown solutions, like in education, we have developed the Education Management Information System. If you have children in school, they are now required to do registration on some system. That is our education management systems. Teachers have been registered, so the issue of having ghost teachers is going to become history. We are using the system to inform government to give the right capitation grants to schools. Because before they were giving out grants without having any data to inform the decisions that they are making. But today, you know, there are so many children in this school. These are the teachers that we have. Or if there are few, how can we get more teachers in that school? All that is being informed by data. And for a solution that has been developed by our own Ugandans. Then we have the parish development model program. This program is talked about by the president everywhere he goes. It's a program that is helping people in the subsistence economy to grow to a commercial economy. We are giving them loans to do various business in agriculture. And then we expect that with that, they will be able to grow their financial potential. But Ministry of ICT has worked together with innovators to develop a parish development management information system. So today, every beneficiary of the PDM money is known. We know the person. We can even go up to their home because we have registered them and have got the GPS locations of their houses. We can know how much money has been given out, the various parts of the regions, etc., etc. Of course, with that amount of data collected, now AI can come on board to help us improve the efficiency of how we are operating. So these initiatives are there, but we still, yes, have a long way to grow up the scale, but also educate and train government officials in government if we are running government systems and we are saying that we want to be artificial intelligence based. And for the health sector, of course, we are still suffering shortage of medical staff in various hospitals. But for us to improve the healthcare, we need to be able to embrace such technologies that will create more efficiency. So incorporating ICT in our national security infrastructure has also helped us to see our security system improve. Today, I know we have CCTV cameras. There was an interesting question yesterday for the manifesto. One person asked, why is it that these CCTVs see big people, but when a big person is stolen or something happens to them, the camera will bring evidence. When it is a small person, they say the cameras either were off or not working. Those are some of the allegations that were being made. But I believe that might not really be the case. But yes, those are some of the things that are being done to appreciate what government is doing to digitize. As I conclude, I would like to take a moment to express again my sincere appreciation to the researchers at Makerere University, particularly those leading initiatives like the AI Health Lab. Your groundbreaking work in AI and its application to health challenges such as malaria, tuberculosis, and cervical cancer is nothing short of inspiring. These are very inspiring results that we have got from you. The contributions from these researchers are laying the foundation for a future where AI is a core component of our healthcare systems and other systems that we have. The other, I think, Sunbird AI has a solution for translating, real time English into various, languages, local languages. I think the last time I engaged with them, you were at 7. Are you still at 7? 9 now. They were at 7, we are now at 9, but we need to get to 52 because Uganda has 52 different languages. And how best can you do that? If you did that for us now, as we are even moving into campaigns, you see the president is in Karamoja, is in Soroti, where that would be very helpful if we had that system in place. So we also acknowledge the tireless efforts of our partners and collaborators, our development partners and government agencies. We appreciate you for creating a conducive environment for innovation to thrive. Without the support of these stakeholders, scaling these innovations would be a far greater challenge. Your continued collaboration is vital in ensuring that we build a future where technology works for all of us. Uganda's strategy for integrating ICT across sectors is and has been very instrumental in driving socio-economic growth. Today we have seen growth in terms of direct jobs in ICT, as well as the indirect jobs that have been created alongside that. We have also seen the growth of the ICT sector contribute 2% to our GDP. But with these conversations and initiatives, this is going to grow bigger and will create employment opportunities for our young people. So let me wind by saying that the digital age offers us countless opportunities to improve and build a more inclusive and prosperous Uganda. So we should all embrace it. And I hope and pray that the recommendations that we have here today are forwarded to the ministry as well, as we are developing our national artificial intelligence policy. I need us to incorporate all the conversations that we have had in this meeting. So we shall be able to sieve out what is policy related, what is strategy related, what is guideline related, and we incorporate all these things. And together we shall make this country a better place and an improved one. I thank you all for listening to me, and I say this for God and my country. Thank you. Okay, I understand there was a launch earlier, but for me to re-emphasize the importance of the launch of this inaugural AI, Artificial Intelligence in Health Africa Conference, We, as a ministry, do support and are fully behind the conference, and I pray and hope that we have this as a sustainable conference. You know, in research they asked us, you know, what are you doing for sustainability? I hope this one has started and is going to stay, and you have all the support from government for this to happen. So I take this opportunity to officially once again declare this conference open. Thank you.
Thank you very much, our dear PS, Permanent Secretary to the Ministry of ICT and National Guidance. Just let's give a round of applause to her. Okay, no. So let's warm our hands properly. Okay, when I say 1, 2, and 3, you direct. Okay, let's now do it. Let's go. 1, 2, 3. Thank you very much, Madam PS, for your wonderful speech. I'm happy that she has re-echoed what we are supposed to do. Collaborate, partner, and continue co-designing. Hey, co-collaborate, co-create, co-partner. Okay, all right. Thank you very much.